Right. Hi, everyone. My name is Julia, and today my team and I are going to be talking about meningitis. So before we start talking about the history of meningitis, I kind of just want to go into what meningitis is briefly. And so meningitis is one of the most common infections of the nervous system. It is an inflammation of the protective membranes covering the brain and spinal cord. There are multiple types of meningitis, including bacterial, viral, parasitic, amoebic, and non-infectious, but bacterial and viral are the most common and the most serious, so those are going to be the ones that we're going to focus on most today. Bacterial meningitis is one of the most serious types, and that is the one that can lead to sepsis and death, and so it requires immediate medical attention. And then viral meningitis is the most common, and it can still be serious, but it's not as serious as bacterial, and anyone with a healthy immune system can usually recover on their own without treatment. So when was it discovered? It was first reported in the 16th century, but at the time they didn't really know what it was, because back then they kind of just grouped diseases together by symptoms rather than kind of like defining which each one was. So it really wasn't until 1805 when there was an epidemic in Geneva, Switzerland, over in Europe, when the physician Gaspard Vusu first kind of like actually had a real description of meningitis. But at the time, he assumed that it was non-infectious and that it was caused by bad air. And so he named it non-contagious malign cerebral fever. But we now know that that is not the case. It is infectious. And so it is now named meningitis. Shortly after this outbreak in Geneva, there were epidemics in other parts of Europe and even other countries, including the United States, and those followed shortly after. So how is it diagnosed, or how did they discover how to diagnose it? So up until the late 19th century, there really wasn't a good accurate way to diagnose meningitis. So the mortality data was kind of inaccurate, and they just weren't really sure who had it and who didn't. And then this changed when Heinrich Quincy, he first described the technique of the lumbar puncture, which is also commonly known as the spinal tap. And that is a procedure where they extract spinal fluid from the spine. But at this time, they had only ever done it on a dead patient. They didn't know how to do it on a live patient. And so it wasn't until Quincy first did this on a live patient for the purpose of diagnostic testing for meningitis. And so he is the one that is accredited with that discovery. And the lumbar puncture is still used today to diagnose meningitis. And it also made the discovery of the lumbar puncture also made it a lot easier to diagnose. So the mortality data became more accurate. And then during that time, like the late 19th century, the mortality rate was around 70%, which was very high. But now it's a lot lower than that. So let's get into treatment and the vaccine. And so the treatments, even just like a couple hundred years ago, were still kind of following the ancient medicine practices. And so the common treatments were bloodletting with leeches, so just kind of extracting blood from the body. They thought it would, rid the body of disease. Blistering would be another type of treatment, and that was done with Spanish flies, which are a type of beetle that has a chemical that is really an irritant to the body. And so they would either rub it on the skin, or they would make them ingest it, and then it would cause blisters on the body, and they thought that the fluid that would be released from those blisters would somehow cure them of the disease. Excessive alcohol consumption, so they would make the patients try to drink as much alcohol as they could, because at the time they thought this gave them strength and would kind of get them through until the disease passed. Emetics, which are agents that are used to induce vomiting, were also used. Opium, which is used to create drugs such as heroin, morphine, and codeine. This was used for sedation. Cold and warmth for pain relief, which we still use today. And then so those were the main treatment techniques, but the ones most commonly used were bloodletting, blistering, and excessive alcohol consumption were the most common for this disease. So the vaccine. So the development of a meningococcal vaccine, which is the most common bacteria that causes bacterial meningitis, was first developed in the late 1960s by a U.S. military research group. In both World War I and World War II, meningitis outbreaks were a serious issue for soldiers, so there was kind of a push to find a vaccine. And then the first vaccine that targeted meningococcal serogroup C, which is like one of the most common strains, was first developed and tested on members of the military in the early 1968. And then by October of 1971, all U.S. armed forces were required to get this vaccine, but it had not yet been approved by the FDA, and so it was not recommended for use for the general population. Vaccines for serogroup A, C, and then another vaccine with a combination of both was registered by the FDA in 1974, but only for limited use, so they only used it for military or like special circumstances. And then the first meningococcal conjugate vaccine, which covered strands A, C, Y, and WI35, which are the 4 of the 5 most common strains that cause meningitis. That was first registered by the FDA in 2005 and approved for use for all persons 11 through 55. And then in the few years following, it led to the point where they recommended that, you know, all children get the vaccine. Okay. And then causes or agent. So it kind of depends for bacterial and virals what causes it. There's several types of bacteria that can cause bacterial meningitis. The leading causes in the United States are Streptococcus pneumoniae, Group B Streptococcus, Neisseria meningitidis, meningococcal, which is the most serious one, Haemophilus influenzae, and Listeria monocytogenes. So those are the most common for bacterial. And then the common causes, like which bacteria affects which age group, it kind of varies. So I have listed those right there. And then for viral, the most common cause of it is non-polio enteroviruses. And those are kind of the viruses that we all get every year when we get a cold or something like that. So they're extremely common, but it's pretty rare for one to cause viral meningitis, but when viral meningitis does occur, that's what it's from. And so these viruses spread most of the time during the spring and the fall. But like I said, it's usually mild, and people who get viral meningitis are usually able to recover if they have a normal immune system. And then other causes for viral meningitis can be the mumps virus, measles virus, influenza virus, arboviruses like West Nile viruses that are caused by mosquitoes, and then herpes viruses. And so if you have one of those viruses, it could lead to meningitis, but it doesn't always. All right, and then that's all I have. I'm going to turn it over to Krista.
Hi, I'm Krista. I'm going to go over who's at risk and signs and symptoms. Anybody of all ages could be at risk. There's certain risk factors that can put people at a higher risk. For viral meningitis, it'll be babies that are younger than 1 month, children younger than 5, people with weakened immune systems, so people who are going through chemotherapy, people with HIV, are usually at high risk. For viral meningitis, people who had organ transplants or bone marrow transplants are also at higher risk. Then into bacterial meningitis, babies are at risk, college students are at a higher risk for bacterial meningitis, and also microbiologists and other scientists who deal with these agents that usually cause meningitis, they're usually at a higher risk as well. And then also people who travel to certain countries in Africa can also be at a higher risk for bacterial meningitis. Fungal meningitis, same, people with weakened immune systems, so people with HIV or cancer, people undergoing chemotherapy. Also, anti-TNF medications, so people who are taking these medications are people with rheumatoid arthritis or lupus, are usually at a higher risk. And then again, living in certain areas in the United States put you at a higher risk. Premature babies are at high risk for the fungal meningitis. For parasitic meningitis, we have people who live in Southwest Asia, Pacific Islands, including Hawaii, are at a higher risk for parasitic meningitis. And also people who live in the Northwest, Northeast, Middle Atlantic, and the West Coast of the United States. And usually that parasitic meningitis is carried by raccoons. And so because these areas have a higher population of raccoons, that's why those certain areas are at higher risk. And then for non-infectious meningitis, there are people who have cancer, lupus, taken certain medications, who've suffered from a brain or head injury, or who've had brain surgery. And then now I'll be moving into the signs and symptoms for meningitis. And so for all of the different meningitis, the most common signs and symptoms are a headache, stiff neck, fever, people who are suffering or who have nausea, vomiting, photophobia, so that's eye light sensitivity. That's pretty common in all of the meningitises, but each one has a few extra, like parasitic meningitis. Most people suffer from mental mental confusion. Also, for fungal meningitis, it's about the same. For viral meningitis, you can also have a lack of energy, trouble sleeping or waking, irritability, poor eating, and also this is for babies or infants. Those are the signs and symptoms. And then for adults and children that have viral meningitis, you'll see headache, stiff neck, photophobia, trouble sleeping or waking, lack of appetite, and lack of energy. People who have mild meningitis usually get better within 7 to 10 days. And then for bacterial meningitis is usually the more severe meningitis. And so people usually have a sudden onset of a fever, headache, stiff neck, and it causes, because it's such a serious illness, the longer you have it, the more it can start to cause serious complications like brain damage, hearing loss, hearing disabilities, learning disabilities, and it's also associated with sepsis. And then other symptoms for bacterial would be nausea and vomiting, photophobia, altered mental status. And then in newborns, it's usually slow or inactivity, irritability, vomiting, poor feeding, abnormal reflexes, and a bulging fontanelle. So the soft spot of the head usually is larger than normal. And that's all for bacterial meningitis. And these symptoms typically develop within 3 to 7 business days from the exposure. And then other more serious symptoms can be seizures and coma. And that's all I have for who's at risk and signs and symptoms. So I'll be passing it on to Damien. Thank you.
Hello, thank you, Krista. Like she said, my name is Damien, and I will be covering the prevention and control of meningitis. And for the prevention, the CDC has some effective strategies to prevent meningitis, which the most common are vaccines. And there are currently 3 types of vaccines for bacteria that can cause meningitis, which are meningococcal vaccines that protect against meningitis. Also pneumococcal vaccines that help protect against S. pneumoniae, and HIV vaccines that help protect against HIV. Also, the control of meningitis. The CDC recommends knowing the symptoms of it, which can appear quickly or over several days, depending on what type of meningitis it is. So like bacterial, fungal, and etc. They also typically develop within 3 to 7 days, like Krista said, and later symptoms can be more serious also. And anyone with symptoms is also encouraged to seek medical attention as soon as possible to prevent and control meningitis. And with any, like any other vaccine, the vaccines that protect against the bacteria are not 100% effective, but the vaccines also do not protect against all the types and strains of each bacteria. And for these reasons, there is still a chance that vaccinated people can develop bacterial meningitis. And some public health efforts for meningitis, the World Health Organization has made some public health efforts to limit the chances of a meningitis outbreak, which are strengthening outbreak preparedness, detection and response, so that prompt and appropriate antibiotic treatment can be offered and suitable vaccines can be selected for a timely response. And second, implementation of case-based surveillance so that epidemiological and laboratory information on every single case is linked and used to evaluate and adapt the control strategies. Third, preventing Men-A disease through vaccination so that millions of vulnerable people can be protected from disease and no longer carry the bacteria, hence stopping transmission. Next, developing a forum for global collaboration so that worldwide meningitis control efforts are coordinated and harnessed for the greatest public health good of all affected countries. And lastly, stimulating research and innovative tools so that the best up-to-date technologies, tools, and guidance are made available for affected countries. And this is from the World Health Organization. That is all I have for my part, and now I will be passing it on.
Thanks, Damien. Josh Granville here. Just want to talk to you about prognosis of meningitis. So what is prognosis? Prognosis is pretty much is a forecasting of the probable, the probable course and outcome of a disease, especially with the chances of recovery. So it's just pretty much like your recovery rate and your success of your recovery and whether or not you successfully recover it. Prognosis depends on the type of meningitis because you have different types of meningitis. So some have higher rates than others. For example, pneumococcal and listeria meningitis associated with higher death rates than meningococcal meningitis. That's from Precision Health 2020. If left untreated, meningitis can be deadly, about 15 to 20%. Also, if patients survive, they have long-term effects in their bodies like seizures and unable to move their limbs, blindness, etc. It's just a multiple effects that could happen as far as just long-term effects after that. However, viral meningitis is the least fatal and typical and has a good prognosis. So I think it's 7 to 10 days for your success rate and with treatment. So also most people, like I said, 7 to 10 days, most people who have the treatment. And there you go. So sources, infectious diseases. Humans can have the virus in their bodies and never know because they don't experience symptoms. We know that's the carriers, like we talking about, like long haulers as well. That same thing as well. Most commonly, bacteria that causes bacterial meningitis is spread from human contact and other humans. So just talking to people, saliva, birth to baby, sneezing, coughing, unwashed hands, just stuff like that. That's how it can spread. Bacterial meningitis can also be spread through food, contaminated food due to people not washing their hands. So people got to wash their hands when spreading up food and passing along food, whatever functions or anything like that. Viral meningitis is spread by coming in close contact with someone who has a virus. although that doesn't always mean another human will get the virus. Viral meningitis from close contact. You may also contact the virus that caused the person to become sick, like measles, mumps, etc. Only a very only a very small amount of people who are infected with viral meningitis causing virus will get viral meningitis. And that is all for sources of infections. I will be passing along to Gabby next.
All right, hi, I'm Gabby. So I'm gonna be just talking about treatment. So with more advanced cases of meningitis, there's hospitalization, so the proper treatment is given. Some children may be even given fluids, just depending on the situation. The most common treatment though for meningitis is antibiotics. There are several antibiotics that can be given, but there's three main ones. Penicillin, ampicillin, and centrifexone. I don't know if I said that right. And there's also a generic version of it as well, just sometimes if you can't afford it. Antibiotics can also decrease the risk of transmission, which I'll talk about in the next slide. And they're taken for a total of about 14 to 21 days, and it's taken in a single daily dose that's given. And typically sometimes no antibiotics are needed to get over the meningitis. It just depends on how severe the case is and what type of meningitis is needed. So for control of this infectious disease, so kind of what Josh already said, in order to control the transmission, minimal contact is recommended. Being isolated sometimes, kind of like quarantine, is recommended to control infection. Also not sneezing around others and coughing on people and stuff like that. The average incubation period is commonly like 4 days. That's how long you're contagious for, but it can last anywhere from 2 to 10 days, just depending on the severity as always and the type of meningitis you get. And this one is just modes of transmission. So again, just like how some of my classmates talked about, the most common mode of transmission for meningitis is through physical contact. So anything like touching, hugging, kissing, passing anything. It can also be airborne, so coughing or sneezing while you're close to somebody. And like Josh had said, it can even be passed through food prepared by others who didn't wash their hands, or even just touching it in any way. Bacteria for meningitis is typically held in the throat, and so in any situation where saliva is crossed, such as kissing, it can cause transmission as well. And these are just going to be our resources for everything that was shown in the slide. I hope y'all really liked our presentation, and that's all we have for y'all guys today.